Hey everybody, I'm Tom. Today we'll be talking about epilepsy, what it is, what causes it, some of the treatment options, and even an exercise prescription for those who have been diagnosed. Let's jump into this. What is epilepsy? So epilepsy is a neurological disorder that's characterized by recurring and unprovoked seizures. And it's very important that you know it's recurring, because isolated seizures does not mean you have epilepsy. And a seizure is the brain's nerve cells sending electrical impulses at a rate much higher than what it should be doing. And so this will result in a variety of reactions. There are several different kinds of seizures. Some are characterized as partial or focal seizures, which they affect only part of the brain rather than the whole thing itself. And then there are the generalized, which cover the brain, and they have a variety of reactions when the seizure takes place. Some are just absent seizures, when kind of loss of awareness, vision, and memory occurs. And then there are some that are like tonic-clonic, and that just means they tense up, their muscles tense up, and then they start to convulse. And that's the one that most people think of when they talk about seizures. And so there's a few other options. Those two are just the most well-known and most common seen among people with epilepsy. So what causes epilepsy? Epilepsy can affect people of all ages and is especially common after some form of brain or damage or head trauma that can affect it. And this includes having a stroke, having a tumor. That is also a reason why someone might develop epilepsy. And then genetics actually plays a role in it too. Some people can have it passed down from one of their parents. And a big part of what causes epilepsy is actually unknown. So it's about 6 out of 10 people don't know why they have epilepsy, and the doctors can't figure it out. That's called idiopathic. And that just means the reason is unknown, but they have it. And so overall, treatment is still the same for all of them. It's not too different between each reason why they have it. And so some of the risk factors. This is beginning with problems or injuries to the brain. That's like the head trauma and the possible tumors or infections. Even some inflammation in the brain can cause epilepsy. Then there's medical history, genetic predisposition. And that's where the genetics from your family members can play a role, giving you a higher risk of having epilepsy. And then some of it's even when you're born. If you were premature, very small when you were born, that can affect your brain as well and cause epilepsy. Or with just medical history, if you're a drug user, that could also affect, because anything that alters your brain like that can do some damage, and that will cause epilepsy. Other conditions even, such as cerebral palsy, Alzheimer's, some developmental disorders, they can also take part in increasing your risk of having epilepsy. And one thing that people think is a risk factor is a concussion. Now, repeated head trauma, that can cause epilepsy, but just single incidents where you might have a seizure because of concussion, that doesn't mean that you have the full epilepsy. You might just have had a single seizure. So that's important to differentiate. And then there are medications and treatments. Now, the first and main treatment is anti-epileptic drugs, AEDs. And 7 out of 10 people use anti-epileptic drugs and are perfectly fine. They have their seizures under control. They don't show up anymore. For some people, though, it does still affect them, and so they have to figure out other options. What has been used for a while now is ketogenic diets, and that means that you're doing a heavy fat diet. So yeah, it seems weird, but you're actually going to increase your fat intake and lower your carbs, because the way your body works and the way it uses energy, when you use energy from fat, you actually release some chemicals that cause you to actually have less seizures, or the potentially have like some up to 50% less seizures than before with a higher diet. There's also vagus nerve stimulation, and so you can see in the picture here, it's set up. They actually put in, it's ultimately sort of like a battery in your chest, and they hook it up to your vagus nerve. And what happens is, every minute or so, it sends an electrical impulse, kind of to regulate it, so it your brain doesn't start firing too quickly, causing a typical seizure. So this kind of keeps it at bay. Then there's, for the severe option, epilepsy surgery. Now that's not as common, especially considering that the AEDs typically work. But epilepsy surgery, they will actually go in and take out part of the brain that is being affected, and that will then take away any seizures. But again, this isn't nearly as common as the other options because it's less invasive. The surgery, obviously, you're taking out part of your brain, so that's a pretty big deal. There's studies and research. So I looked into it, and research has shown for exercise, it can actually help reduce the frequency of episodes. So for those who like to work out, they might actually tend to have less seizures or less severe seizures if they do have them than those who do not work out. And a lot of people think exercise will like trigger it, but it actually can help. Certain exercises, when you do too heavy and you're unsupervised, it can be a little dangerous. But for the most part, any exercise you want to do, you're able to do. And so there really should be no restrictions for those with controlled epilepsy. It actually helps a lot of people nowadays, and it's recommended by a lot of different places, and it's been proven in a lot of research and studies. And so also it can AEDs tend to cause osteoporosis in some patients, and so resistance training actually increases their bone density, or like keeps their bone density where it's at, rather than lowering it due to osteoporosis. And here's a case study. It's so right now we got a female, 36 years old, non-smoker, which is good. She was diagnosed 7 years ago with tonic-clonic seizures, and again, that's the one that you think of when it comes to seizures. But she's on AEDs, and they have been effective, so she no longer has any seizures, with no side effects, which is good, no osteoporosis or anything, and the epilepsy is idiopathic. So she doesn't know the reason why, but we don't have to worry about that too much if the AEDs are working for her. She used to work out, she used to exercise a lot, and had to stop once her seizures began because she felt a little worried. She was a little hesitant because she didn't want to trigger anything causing problems especially if she was working out alone. It says her diet is very healthy. She BMI is 20, resting heart rate 68, blood pressure 122/80. All that looks really good. So I think a lot of that has to do with her eating a healthy diet, even though she's not working out. But for her, we can have this exercise prescription. And so I got her doing some aerobic training, resistance training, and a little flexibility. So for aerobic training, we're going to do 3 to 5 days a week, about half an hour to an hour, moderate intensity. And walking or cycling are good examples, especially cycling, like rather than treadmills, in case anything were to happen. It's a lot safer. And so then resistance training, we got 3 to 4 days a week, 30 to 60 minutes again. Light to moderate exercise, especially in the beginning, because again, it's been roughly 7 years that she's had epilepsy and she's reduced her exercise. And so we gotta have her slowly get back into this. Machines and resistance bands will work just fine. Flexibility is just 2 to 3 days a week, 10 to 15 minutes. It's pretty standard. Stretch until mild discomfort. We don't have to do anything too severe, and like that won't really trigger anything, so she's pretty safe. But you always want to do some flexibility. And so that's her exercise prescription, because once again, with epilepsy, you don't have to really change too much about how you exercise, especially in her case because she is using AEDs and they are working for her. The one concern is going too high in intensity and possibly triggering. If she's really testing her boundaries, she might want to be supervised. And obviously, without a doubt, she could talk to her doctor about this just to have him in the know, understand that she's going back to exercise, and talk to him about any concerns that she may have too. For more information, you can go to the websites here, the Epilepsy Society, Epilepsy Foundation as well. And especially for information about exercising with epilepsy, I have a link here for you. And that's really good. It has a lot of information on that. And here's all my citations for you. I got a lot of research done here. Alright, and that's going to be it. So there's some information about epilepsy for you. Thanks.